Aberdeen has always been more than the headlines. Beneath the oil and granite is a city shaped by its people, by generations of care, creativity, and quiet determination.
Across our communities, people have worked hard to make life better. Their efforts have laid the foundations we stand on today, and now we have a chance to build something even stronger.
As we look ahead to the next local outcome improvement plan that carries us through to 2036, this can't just be another document. Instead, it's an invitation to pause, to look closely, to see the whole picture, the progress, the pain, and the potential.
Because if we're serious about creating a fairer future, we need to think bigger, ask bolder questions, and give Aberdeen the ambition it deserves.
Let's move beyond the familiar. Let's stay curious. Let's take stock of where we are and come together at Aberdeen 2036 towards a fairer future, to explore how we use this opportunity to create a city where every child, every family, every neighbourhood has the chance to thrive.
When people think of Aberdeen, they often picture an energy-rich, affluent city. And yes, the data suggests many Aberdonians are doing well. But when we zoom in on individual communities and neighbourhoods, the picture changes. Too many people still don't have access to the same opportunities.
1 in 7 households in Aberdeen have no one in work. That's 13,700 homes where economic opportunity feels out of reach. Employment rates for ethnic minority citizens sit at 65.2%. compared to 75% for the city's working-age population.
Through the Your Place, Your Plans, Your Future consultation, people told us how important access to good jobs and employability support is, especially for priority groups. Skills development and helping Aberdeen diversify beyond oil and gas were seen as key to opening up fairer job opportunities.
But since 2019, the number of growth sector enterprises in the city has fallen by 1,150, a 23.7% drop.
Income matters too. In Aberdeen, 3,600 children are growing up in low-income households, and 10% of employees are earning less than the living wage. Slightly better than the Scottish average, but we can and should do better.
So as we look at the next 10 years, let's ask ourselves,
how can we support good quality employment?
What role can we play in the rejuvenation of Aberdeen's economy?
What opportunities can be opened up for those who've had the least access until now?
Change is possible.
A thriving economy means people can access high-quality work that allows them to live in a home that meets their needs, afford the essential, and support their health and well-being. And the foundations for all of this are laid in our earliest years.
When we talk about giving children the best start in life, we need to be honest about the uneven playing field they're starting on.
A healthy start for mums is key to giving babies the best possible beginning, but across the city there are differences in health of mothers and babies, linked to things like smoking during pregnancy, unhealthy weight, and breastfeeding.
In our least affluent areas, around 1 in 4 pregnant women smoke, compared to just 3% in the most affluent. And there are also big differences in rates of unhealthy maternal weight and breastfeeding.
These early gaps shape a child's health before they've even taken their first steps. We need to close them.
By the time children reach school, those differences are still visible. In our least well-off areas, 73% of pupils in Primary 1 are healthy weight. That rises to 82% in the most affluent parts of the city.
Dental health follows a similar pattern. 57% of Primary 1 children in the least affluent areas having no obvious tooth decay, compared to 80% in our most affluent.
Mental health is another concern. 1 in 5 Primary 6 and Primary 7 pupils and 1 in 3 secondary pupils report low mood. The suicide rate among young people has also increased.
But there's good news too. Smoking, alcohol and drug use among school pupils in Aberdeen are low, and that needs to be protected.
When it comes to education, most young people are doing well, but the gap is still there. In our most affluent areas, 95.3% of school leavers go into work, further education or training. In our least affluent areas, that figure is 82.9%.
Young people in those neighbourhoods are more likely to miss school, to be excluded, and to leave with fewer qualifications.
81.3% of care-experienced young people reach positive destinations. That's nearly 9% lower than the city average. For disabled young people, however, their percentage of positive destinations is only 0.6% lower than the city average. What do these numbers say about our system?
Youth crime had been falling since 2016, but it started to rise again. In 2024, 590 young people under 18 were recorded as being accused in a crime, up from 546 in 2021-22.
It's not too late to chart a new course.
What would we have to change to make play and recreation more inclusive?
What role can we play in supporting young people to have a louder voice?
Children don't grow up in isolation. They grow up in homes, on streets, and in neighbourhoods that shape how safe, connected, and confident they feel.
So, if we want every child to thrive, we also need to think about communities around them, about housing, about strong local networks, about feeling proud of the place you call home.
So let's zoom out and ask, what kind of Aberdeen are we building, and who gets to belong in it?
Aberdeen is a city of contrasts, not just in income, but in how people experience community and home.
Many face barriers to finding good quality, safe and affordable homes. Nearly 2,000 people were linked to homeless applications last year. Almost 600 of them, which is 33%, were children.
13% of people experiencing homelessness in Aberdeen have a mental health support need. Around 4% of issues with substance use, often alongside poor mental health or a physical or learning disability.
The most common reason for people becoming homeless is being asked to leave where they were staying, often a parent, partner, or friend's home. 11.8% of people told us they were leaving due to a violent or abusive dispute in the household.
Food and fuel poverty are concerns too. In 2023-24, an average of 4,600 food parcels were distributed every month, up from around 4,400 the year before. A fifth of CityVoice respondents said that they had to stick to only a few kinds of food because of money worries. A quarter were concerned they wouldn't be able to afford heating.
In our 13 priority neighbourhoods, people are more likely to struggle with these challenges. They're also more likely to feel isolated, unheard, and disconnected from decisions which shape their lives.
Respondents in our least well-off areas scored an average of 2.5 out of 5 when asked if they feel able to participate in decisions and help change things for the better. For the most affluent areas, that score was 3.6.
But the communities know what they need. They've told us more affordable, energy-efficient homes, better maintained public spaces, local events that bring people together.
What would a city without stigma look like?
What if every neighbourhood had the tools to shape its own future?
By tackling poverty head-on, we build stronger, more connected communities where everyone has a place to call home.
The places we live don't just shape our sense of community, they shape our health, our opportunities, and our future.
From housing quality to the strong local networks, we've seen how physical surroundings influence well-being. But as climate change accelerates and infrastructure ages, we need to ask, how do we make our neighbourhoods not just livable, but resilient?
It's time to look beyond bricks and mortar. Let's explore how nature, transport, and public spaces can support healthier, more connected lives, and how Aberdeen's environment can be a part of the solution, not just another challenge.
Climate change isn't just a global issue, it's a local one. In Aberdeen, its direct effects include increased illness and death linked to extreme heat and cold, and damage caused by flooding. It's also likely to widen inequities around air quality, fuel and food poverty, and access to green space.
For example, while the number of children hospitalised with asthma is falling nationally, in Aberdeen it's rising.
That said, progress is happening. Aberdeen's carbon emissions are falling and less household waste is going to landfill. Let's keep this momentum going.
More and more people in Aberdeen see climate change as an urgent issue, but its impacts don't fall equally.
Flooding, poor air quality and extreme weather hit hardest in communities least equipped to cope. 32,510 people in Aberdeen are at risk of flooding, yet only 46% say they would know where to find information or support to prepare for severe weather.
More than a quarter of people say that they've taken steps to protect their own homes, but only 6.5% think their wider community has done the same.
While we work towards net zero, we also need to adapt, making sure our systems, services and streets are ready for the future.
That means making walking, cycling and wheeling easy, safe and accessible. It means clean, welcoming green spaces for everyone, and it means tackling everyday issues like litter, poor lighting and unsafe pavements, the small things that have a big impact on how people feel about where they live.
In what way is nature part of the solution?
What would need to happen for walking, wheeling and cycling to be the easiest, safest options?
What if our surroundings supported our health and didn't get in the way?
The air we breathe, the streets we walk, the green spaces we use, these aren't just backdrops to our lives. They are part of what keeps us well.
But health isn't shaped by environment alone. It's also shaped by income, connection and care, and by how well the systems around us are designed to support rather than strain.
So let's turn our attention to health and social care, not just as services we turn to in crisis, but as part of a bigger picture where prevention, equity and dignity guide how we care for each other.
Across Aberdeen, life expectancy has stalled, and healthy life expectancy, which is the years people live feeling well, is getting shorter. Many people spend a significant proportion of their lives managing health challenges that affect their daily activities.
We see that these challenges are more common in our least affluent communities, where people tend to have shorter lives and spend more time with long-term health conditions. Around 1 in 5 adults say they have a lasting illness or disability that limits what they can do. Addressing these health inequalities remains essential.
The reasons behind these differences are complex, but they're not a mystery. Factors like poverty, poor housing, social isolation, and limited access to services all play a role. Health behaviours such as smoking, alcohol and drug use, unhealthy weight, and inactivity also contribute, but these don't happen in isolation.
In 2023, cancer and circulatory diseases like heart disease and stroke made up just over half of all deaths in Aberdeen. People in our least well-off areas are more likely to die from these causes, as well as from alcohol or drug-related conditions. Mental health is also a growing concern.
Hospital admissions highlight these differences clearly. Alcohol-related admissions from the least affluent areas were nearly 3 times higher than those from the most well-off communities in 2023-24. Similarly, drug-related admissions were over 12 times higher.
Mental health remains a critical issue. Prescriptions for anxiety and depression have risen over the last decade, especially in communities facing greater challenges. Suicide rates have stayed steady, but continue to demand our attention.
Nearly half of people aged 65 and over report having a long-term illness that limits their activities. How might we better support active aging and enable people to support their health and well-being?
Living well as we age isn't just about healthcare. It's also about feeling safe and connected in our communities. That sense of safety and belonging is shaped not only by the support we receive, but by the environments we share.
During the Your Place, Your Plans, Your Future engagement, many told us that reducing antisocial behaviour is important. While Aberdeen's rates are below the national average, nearly 2,000 such offences were recorded in 2023-24.
In 2023-24, there were 2,512 recorded incidents of domestic abuse in Aberdeen, slightly up from the year before. That's 110 incidents for every 10,000 people, a rate that's lower than the national average, but still rising.
Not every incident leads to a recorded crime, but the number of domestic abuse crimes has also increased, from 116 to 142 in just 1 year.
The story is similar with hate crime. There were 316 recorded incidents in Aberdeen last year, higher than the year before, though lower than in 2021-22.
Behind every one of these numbers is a person, someone who deserves to feel safe, respected and supported in their homes, in their communities and in our systems.
When people feel unsafe or unsupported, it affects more than just their mental and physical health. It affects confidence, trust and participation in all areas of life.
What if every person in Aberdeen could count on safety, support and respect wherever they live, whoever they are?
How can we prevent ill health and crime? And what if we tackle the root causes, not just the symptoms?
Together, we have the chance to create a future where everyone has the opportunity to live well for longer.
We've seen the progress, the challenges and the potential across Aberdeen. The work already happening shows what's possible when people come together with purpose.
But the future calls for more ambition, more creativity, more courage to imagine a city that works better for everyone.
What if we change the systems? What if we unlock new opportunities for every neighbourhood, every family and every person? And what if, together, we made Aberdeen a place where fairness isn't just a goal, but a reality experienced by all?
This moment is an invitation to think bigger, to ask bolder questions, and to shape a future we can all believe in.
The path won't be easy, but the people, the passion, and the power to make change are already here.
So let's take that next step.
With confidence,
with respect,
and with hope.